Welcome to an introduction to the therapeutic use of self and responsive behaviors, a collaboration of the WRHA Behavior Resource and Consultation Team, Long-Term Care Program, and Geriatric Outreach Teams. Therapeutic use of self can be defined as a healthcare provider's use of verbal and nonverbal communication, emotional exchange, and other aspects of his or her personality to establish a relationship with a patient that promotes cooperation and healing. Okay, that's pretty impressive sounding, but what does it really mean? What it really means is that when working with someone with responsive behaviors, the most powerful tool that you have is you. First, let's quickly remember what we know about responsive behaviors. All behavior has meaning. It's a way of communicating. And responsive behaviors are responding to something, an unmet need or feeling threatened, for example. Often, people with dementia, complex mental illness, substance use, and/or neurological disorders cannot tell us exactly what their needs are or what might have triggered responsive behaviors, so figuring that out becomes the caregiver's job. There can be a lot of things to consider, and it can be very difficult to figure out. While there are many things to think about when dealing with responsive behaviors, in every situation there is one constant. Your relationship with the person. Every helping relationship is a partnership. The qualities of that partnership can have a huge impact on whether or not you're likely to be one of the causes of someone's distress or one of the solutions. Understanding your potential to influence someone's emotions and in turn their behavior expressions is an essential step to providing quality care. Responding to someone else's approach is not something that's specific to people in healthcare. This affects us all of the time. Imagine you're at work. You're overwhelmed and a workmate comes into the room that you're in. You say to them, "I'm so overwhelmed, I don't know how I'm going to make it through this day." They look at you and then walk away without a word. You continue now with your overwhelmed day, adding frustration and a feeling of being ignored and unimportant. How might this affect your behavior? If you had dementia, complex mental illness, substance use, or neurological disorders, and had much more difficulty managing your behavior, how might you respond? If that coworker's response had been different, even if she couldn't solve the problems for you, your feelings of being respected and valued could have changed that situation. The person may not have meant any disrespect, but in a partnership, the messages that we send can have a huge impact. Knowing and remembering that your approach and your relationship with a person can have a huge impact on behavior and on your ability to help someone change their response is empowering. This is your most powerful tool. It also comes with some work to be done. Building your skills to use yourself as your best tool requires you to take a good look at yourself and your thoughts, feelings, and actions. Mentally review how an interaction went. What happened before? How did you react? Could your approach have been a trigger? Was your approach helpful in diffusing a situation? What worked? What didn't? We need to think about labels and judgments that we use unintentionally, as they can be expressed to our clients, patients, or residents even when we don't mean to. The words that we choose can be very impactful. The Alzheimer's Society's Person-Centered Language Guidelines is a great resource to explore this, and the principles are similar for people with other disease processes as well. As you build your tool, journaling your thoughts may help you find patterns and get to know your own tendencies so that you can build good habits. When appropriate, you can check with a person and ask them what they find helpful. And share your findings with the team about what works best and what does not for a given relationship. What else can we do once we recognize and take responsibility for the profound impact that our approach can have on triggering and diffusing behaviors? First of all, the more you know about the individual, the better. Each person has different needs based on personality, history, and disease. If you know one person with dementia, addictions, or mental illness, you know one person with dementia, addictions, or mental illness. Knowing about a person's history and personality will help you find ways to avoid triggers, help them when distressed, and the act of taking interest will help you build your relationship, strengthening your tool of partnership. Things that you can be sure to do in the moment that are likely to help prevent responsive behaviors or to help deal with them, or to always connect with the person as an individual before getting to your agenda. Rather than starting an interaction by identifying a task that needs to be done, take a few moments and say hello and establish a personal connection first. Similarly, connect with the person before trying to correct a behavior. One way to do this is to show empathy by making it clear that you see that they are upset and that you are there to help. We often try to go to distraction or to get the person to stop a behavior as our first interaction. It may be much more effective to start by letting them know that you see their emotions and that they have a need. Here's an example. You find Mr. Smith in Mr. Jones's room going through his closet. When you approach Mr. Smith, you could walk up and say, "Mr. Smith, this isn't your room. Come on now, let's get out of Mr. Jones's closet." This may work, but it's more likely to make Mr. Smith feel defensive because you went straight to correcting him. If you instead tried saying, "Hi, Mr. Smith, how are you doing?" he may volunteer what he's looking for. If not, you could continue, "Are you looking for a sweater? I find it a bit cold in here sometimes." Now you're connecting with him and looking for meaning in the behavior. He might feel important and connected, which is a much better way to start the interaction and may lay the groundwork for moving him to his own closet more successfully. Some strategies that you can use to build a trusting relationship over the long term include calling them by name, engaging the person when you don't need to, showing an interest in them, pay a compliment, identify common interests and discuss them, talk with them about what's happening around, and be dependable. Keep your word and be sincere. These strategies help build a trusting connection, which will help you to be seen as a safe place rather than a threat. Further to the goal of establishing a trust relationship, there are things that you can do to reduce the natural power imbalance that exists between a care provider and a person receiving care. These moments of investing in connection, as already discussed, will help with this. Laughing together, validating feelings, active listening, and sharing a little bit about yourself as appropriate can all help as well. The impact of nonverbal communication cannot be overemphasized. Even when people cannot understand or take in the words that you're saying, they instinctively read body language and tone of voice, and these are the dominant communication. Even if you're saying the right thing, if your tone and posture don't convey the same message, your words will lose meaning, and you will be perceived as insincere and untrustworthy. So remember, first impressions are very important. Start with a friendly greeting and introduction. Make eye contact so that people know that you're worth their focus. Watch your facial expressions. Sometimes we send messages that we don't realize we're sending. Be careful with your tone of voice and body language. Whenever possible, provide undivided attention to the person you're dealing with. And show good listening behaviors like leaning forward and looking engaged. Through the therapeutic use of self, seeing ourselves as a major influencer of circumstances and behavior expressions, we can work to promote feelings of safety through reassurance, connection, and relationship, of respect through our nonverbal communication, taking time to engage, calling people by their name, asking their opinions, learning about them, and apologizing if necessary. Feelings of control by providing choice, letting people do for themselves whatever they can, protecting privacy by talking about private things in private and ensuring privacy for personal care, and feelings of comfort by meeting people's needs and offering comfort measures. If your patient, resident, or client associates you with these approaches, you are much less likely to be the trigger of responsive behaviors and will have more success when trying to redirect. Owning your role in helping others to regulate their reaction through your approach and interactions is a vital step in management of responsive behaviors and is an important tool to support the success of other non-pharmacological interventions.